Welcome to the Solutions Podcast, the show that helps forward-thinking podiatrists achieve greater podiatric success. Here are your hosts, Dr. Michael E. Graham and Mr. Matthew Sole.
Hey everyone, and welcome to the Solutions SoleCast. I'm Matt Sole.
And I'm Dr. Michael Graham.
Today we're joined by Ben Pogue, the founder of Free Life Labs. Ben brings over 2 decades of medical sales experience with the last 10 years dedicated to podiatry. He leads the company behind products like Nerve Reverse and Woundworks, a natural science-backed supplements that help patients manage nerve pain and heal faster without the side effects of prescription drugs. Whether you're looking to grow your cash pay offerings or give your patients better treatment options, this episode's going to be packed with insights that you can implement right away. So let's jump right into it. Ben, how are you doing?
I'm doing great. Thanks for having me on, guys. Appreciate it.
Really appreciate you taking the time, and we're excited to jump into this. So why don't we get to your background? What got you into this space in the first place?
Yeah, about 11, 12 years ago, I had another company and we were doing a test that would actually test for neuropathy. And it was, Dr. Graham, I don't know if you know about this test, but it was a test called pseudoscan. And it actually is a non-invasive test that measured sweat function. Well, we got into it and it was going great. But one of the things that just kept coming up with a lot of patients was, okay, I have small fiber neuropathy. Now what do I do? Right? So, and we would always just say, well, you have to go talk to your doctor. And then they'd go talk to their doctor. And what would the doctor do? Typically, they would put them on like gabapentin or Lyrica or any of these drugs that really aren't going to really do a whole lot other than maybe make them feel better, but it's not going to help the neuropathy situation. Also, at that same time, my father was experiencing a lot of issues with neuropathy as well. And so as we were kind of going from doctor to doctor, and they were felt like they were just kind of passing him around. And it got a little bit frustrating. They put him on the gabapentin. He didn't like the side effects from that. And bottom line is I just I went out and I looked at all the evidence and I did my research and looked at, there's got to be other things nutritionally that can help these patients. I felt like of the patients that we were seeing doing this test were extremely frustrated with their options and just frustrated that they just kind of felt like they were getting, like my father, getting passed around from doctor to doctor and nobody could really help them. So I do have a little bit of a nutritional background as well. So I used to work in the bariatric surgery world. And after patients have bariatric surgery, we know that nutrition is extremely important. You know, when your stomach is the size of an egg, basically at that point, you're going to need to supplement with nutrition. So I kind of took a lot of that experience that I learned from that, a lot of the experience that I learned from our neuropathy testing, and I started Nerve Reverse, which is our nutritional supplement that helps people that have neuropathy. Typically, diabetic neuropathy is who we're using this on, the majority of our patients, but it can also be used on chemotherapy-induced neuropathy. Anything blood flow related. So anything that's like anatomical, like a pinched nerve, probably not going to work very well, but anything blood flow related. So that's kind of the background on how we got started. And since then, we've been in business for 10 years. We treated thousands of patients with Nerve Reverse with extremely phenomenal success. I mean, it's just been a good ride with how well things are going with the product. And then we've since added additional products on from there as well.
Whenever there's that personal tie, I feel that that's what helps drive a lot of businesses, but you're kind of in that right space at the right time where it seems like the profession is getting a little bit more into some of the, I won't say kind of holistic-ish, like look at the full body, look at the nutritional side. It's not just the foot. So that there's that trend that we gotta bring in more supplements. We gotta have a more comprehensive treatment solution than just some of the outdated models that were there before.
Yeah, I mean, and people want that too. I mean, I think that's sometimes that's a little bit of a resistance with some of the podiatrists that we talk to is they're still stuck in this, I gotta prescribe meds mindset. I gotta prescribe medications because, well, I get it. That's what you're trained on. That's what you guys have learned in school. But at the same time, the majority of patients that we talk to, at least, don't want that stuff. They would rather go the more natural remedies route without the side effects. So I don't know, Dr. Graham, I don't know about your experience in that realm.
For sure. I mean, this, like you were saying with your father, like the side effects of these other medications are brutal.
Yeah.
And so patients, are really hopeful that this is going to be, this medication that they're going to take that's going to heal their nerves. But in reality, there's no healing that's occurring. More damage is occurring. The patients are heading the wrong way. It's getting worse, not better.
Right.
And so that's why something like Nerve Reverse is so important, is because it's there like fixing the problem, not just covering it up, not putting a Band-Aid on it. So that's why when we learned about this is like, I'm so excited about it and definitely wanted to learn more.
Most of the doctors we still talk to are using gabapentin. And the challenge with it is that psychologically for the patient, yeah, you can put them on gabapentin and they might start feeling better. The problem with that is, well, then the patient comes back in and they meet with the doctor as a follow-up, and the doctor asks them, well, how are things going? What's the patient going to say? They're going to say, oh, things are much better. Things are better because they feel better. The problem is their neuropathy is still progressing and it's getting worse. They just don't know that. And then the doctor's going to say, oh, well, okay, things are getting better, when actually it's just getting worse. And then they've got to up their dosage, their medications more and more and more and more until they're maxed out on their meds. And then at that point, it'd be too late. I mean, even Nerve Reverse at that point may not work for the patient. And so that's the game that we're playing right now, unfortunately. And we're trying to do our best as a company to educate, as many people as possible.
Yeah, I mean, and that is the double-edged sword with the other medications, is you hit it right on the head of, you're gonna have to keep prescribing more, higher doses, and then with those higher doses come more side effects. So now you're prescribing and doing other things to try to combat that. And, again, it's just you're heading down the wrong path versus taking something that's going to increase blood flow and help nerve health. So that's why it's so important. And maybe it is a combination with other things too, but I mean, you have to start there. You need to have that nerve nutrition.
Yeah, and we never say, if they're on gabapentin, we don't say, oh, just stop your gabapentin and go on Nerve Reverse. But we do have a lot of patients that they'll be able to wean off that gabapentin. So slowly kind of cut back on those medications and at some point just totally wean off of the gabapentin, and then they can be on that Nerve Reverse. I mean, anybody that is taking metformin should be taking a supplement. Metformin actually inhibits B12 absorption and absorption of some other B vitamins. And so if you're on metformin and you're not supplementing with extra B, a lot of times they can get misdiagnosed as actually having like diabetic neuropathy, when in fact it's a nutritional deficiency. They're just nutritionally deficient, which is causing a lot of the neuropathy issues, because they're taking metformin and because they're not getting enough of the B vitamins to be absorbed.
So, and that's one thing too, that could be, something in the patient's mind is, when you're taking the supplement, it's not like you're going to take it and then right away, like all of a sudden your neuropathy symptoms are going to be gone, like they're going to disappear overnight. So this is something that it's maintenance. I mean, you need to stay on this and be consistent with it, whether you feel the difference or not. Like that, I think that's so important, because it's getting to where it has to go. And the great thing about peripheral nerve damage is peripheral nerves can regenerate if given the chance.
And they can, and they can regenerate with high levels of B vitamins, which is what we're using in our product. So there's a really cool study, and this is really the main study that we use to build our product. So Metnex was kind of like, they were like the big company at one point, and their product was a prescription product. And they wanted to show if nerve fiber density was actually being improved. So basically what you just said, are nerves being regenerated with high dosage B vitamins? And the study did show that after 6 months of usage, and they measured this through punch biopsy. So they do a punch biopsy at the start, and then they did a punch biopsy 6 months after using Metnex, and they noticed a statistically significant difference in that nerve fiber density. And that that study actually is what caused me to launch my company, because at that point I said, we're not just placebo here, we're actually improving the actual nerve instead of just the gabapentin. There's a study too that I was just reading about, and it's a review of a bunch of different studies. It took data from 37 studies over 5,000 participants, and it showed that only 35% of people taking gabapentin experienced at least a 50% reduction in symptoms. Now, this is the kicker, though. So only 35% of people taking gabapentin experienced at least 50%, but placebo was?
Yeah, exactly. Yeah. How about
So
that?
all that evidence just pointed towards, look, this isn't working, what we're
Right.
doing.
For sure.
And we've got to have different alternatives for these patients. And we don't claim that our product works every time either. We don't. It's not going to work for everybody. There's a lot of different factors that can go into this. That there's, how bad is your diabetes? How well are you managing your blood sugar levels? How long have you had neuropathy? Has it been an ongoing thing? Is the neuropathy still progressing? But what we do is, and the nice thing that our doctors and patients love, is that we guarantee that the product's going to work for you, or we give you your money back. And so if the patient uses it for 90 days and after that 90 days, they kind of feel like, yeah, I just didn't really notice any difference. I didn't really, feel any different. My feet still are burning, or I still have the tingling sensation. Then we just do a full refund. And so it's like, you can't really get any better than that. I mean, we definitely stand behind what we're doing, and we know that the product works. It's just, you've got to try it, and you've got to be consistent with it, and you've got to give it time. Like what you were talking about earlier, Dr. Graham, you can't just expect results in a few days. It's going to take a little bit of time. Your nerves didn't die overnight, so they're not going to be repaired overnight.
I think that's really important for the podiatrists out there to understand, is that, this isn't voodoo science. I mean, there's real science that backs this up. And so when they're out there, seeing patients with neuropathy and taking metformin, things like that, I mean, they need to be thinking about, what kind of a, supplement can we recommend to them? And I know for, a lot of podiatrists, there's like a little bit of a guilt or a weird feeling, let's say, in the back of their head if they act like a pharmacy. And I think that's something that we should talk about. Why not have something right there in your office to say, this is a product that I've researched that has a long history of usage. There's no guarantees with anything, but this is something that there's a tremendous benefit. And why send patients to a wild goose chase to another facility to try to find this, rather than them walking out of the office with it in their hand when they can start using it right away? So, I mean, there's benefits for the patient, benefits for the practice, and it's a win-win situation.
Yeah, I can't tell you how many podiatrists we talk to that we'll ask them, what are you doing for your neuropathy patients in your office? And they'll say nothing. And my brain just explodes when I hear that, because I have a personal connection to that with what I went through with my dad. And so when I hear that, it's a little bit difficult. And a lot of times they'll say, sometimes a podiatrist will say, well, I just send them back to their primary care doctor. It's like, no, like you're the specialist. You're the foot guy. You're the guy that should be taking care of this patient. And I think the reason they do that, I haven't really gotten into a whole lot of detail with them, but I think the reason that they do that is because they don't think they can help the patient. They think that, yeah, it's neuropathy and there's not much that I can do for the patient. So rather than give them false hope, I'm just going to send them back to the primary care physician and let them give the patient false hope. I don't know the logic there, but
it's the primary care physician doesn't know what to do. So that's why they're sending them to the podiatrist. Their only option, I mean, they don't even touch most patients' feet with neuropathy. They keep their socks and shoes on. They're like, well, you have something with your feet. We'll send you to podiatry and see if they can come up with anything. Otherwise it's just gabapentin or some other medications and, that we already talked about. So that's why podiatry, we need to be more proactive on this. And, when somebody comes in with an ingrown toenail, we know what to do. And I think it's just, with the neuropathy, there's so many unknowns and so many different factors. But at the end of the day, start the supplements. It's not going to hurt them.
It's not going to hurt. It's only going to help them.
That's right.
Yeah. It's only going to help them. And people, trust me when I say this, people want this. They want a natural product. Back to your point, Dr. Graham, about, having this product accessible. We just know that if the patient has to leave the office and they have to go somewhere else to get what you're recommending, the chances of them actually getting it are substantially lower than if you just had it right there in the office and the patient leaves with the product in hand. Especially if you let them know, hey, we have a guarantee. And that's the nice thing about our program is the patient's not out any money, the doctor's not out any money. We're the only ones that lose money in that situation. And we're willing to take that gamble because we know that the product works very well for a lot of the patients. But it's hard enough getting patients to take stuff. And, we just know compliance is difficult, man. It's just, you'd think it would be an easy thing to just pop a pill, but it's not. It's not for most patients. There's a really well-known study out there that says that 50% of the patients that have diabetes don't take their diabetes medication in a compliant way. And so how do we get them to take a nutritional supplement? Well, the first step is stock it in the office. You don't have to pay for shipping. You can just get it right here in the office. And it's just a win-win for everybody. A lot of times our doctors will even tell us yeah, my patient came in and they already knew about Nerve Reverse before I even talked to them about it. And that's just a home run because if your patients are already educated before they even come in, that's easy at that point.
For those podiatrists that are wondering, how do I explain Nerve Reverse to a patient? Maybe they've got some history, maybe they've tried some stuff that doesn't work. What's the best way to educate them on the benefits of your product, what it does, to get them to be excited about that natural option?
Bottom line is they need to understand that gabapentin is doing nothing for their nerves. So the patient, they think it is. And the patients generally most of the time are thinking that drug that they're on is helping their nerves. It's not. Masking symptoms. Your Nerve Reverse, on the other hand, is helping to improve blood flow. You're improving vasodilation. You're opening up basically the blood that's going to the nerves, and you're reducing a lot of the inflammation around the nerves as well. And we're actually getting more blood to the extremities, which in turn is going to help to improve the actual nerve health. So instead of just masking the symptoms and treating the symptoms, we're actually going to be able to improve the actual health of the nerve. That's why we always recommend too, this isn't just you only use Nerve Reverse, right? So you would want to use this in combination with other things. And one of the things that we found works really well as well is laser therapy, right? So using a nutritional supplement in combination with laser therapy, we know that laser therapy has been clinically studied and looked at when it comes to helping improve circulation and blood flow, right? That's all we're doing. We're just trying to open up the blood path and getting that blood going to the extremities. And that in turn is going to help improve the health of the nerve.
Yeah, and I think that's one thing that this is one of my missions in life too, that one day I'll get working on, is just staging of neuropathy and where do you start the treatment. And that's where I think so many podiatrists, it's just, we really don't have that. What is the treatment program for it. But it all, again, you can do laser, you can do all these other things, but until you help the inside health of the nerve, you're really not doing any good. It's just like a tire. You can patch the tire, but you still got to put air in it. Otherwise, it's not going to work.
Well, and just along those lines, so if somebody's taking nerve reverse, they're doing laser, but yet they're not controlling their blood sugar. Okay, well then it's probably not going to work. There's all these different factors that are involved. We don't say like just take our product and everything's better.
That's right. It's not a cure-all. Yeah.
You got to use multiple modalities on this stuff, especially something as tricky as neuropathy. As we know, it's one of the hardest things to treat. At least that's what I hear from my doctors. And it's not just going to be a one thing fix all. It's going to be multiple modalities. But it's funny because neuropathy is such a big market right now, and it's such a big need for people that podiatrists better watch out, because the chiropractors are actually treating neuropathy now, which is just, when I kind of heard that, my brain was just like, what is going on here? And why are they doing it? They're doing it because patients are frustrated. They've been passed around from doctor to doctor to doctor. They're complaining to the chiropractor all day long when they go in and see the chiropractor. And what is the chiropractor doing? He's thinking, well, dang, I can probably find something to help you. And so they're pulling patients away from podiatry and taking those patients that, in my opinion, and there's nothing against chiropractors, but I don't think necessarily they should be treating the neuropathy. I think the podiatrist should be the ones actually treating the neuropathy. But if they're not getting help, they're going to go to wherever they get help.
Can you talk a little bit, not to nerd out too much on what's in Nerve Reverse, but I know you went out to make the best product out there, and it's got a ton of benefits beyond just the support you as a company give. So what sets Nerve Reverse apart?
So our biggest selling point is the price for what's in it. So the value of what you're getting in the product cannot be beat. So we've got 6 ingredients. This is all mega doses of the ingredients. So it's not something that you can just go pick up at Walmart. First off, we use all methylated forms. So that's important because a lot of people, and most people don't know this is a good education point, 50% of people in the United States have a gene variation. It's called the MTHFR gene variant. This gene variant does not allow your body to convert non-methylated forms, specifically folic acid, but also can be like B12 as well. What does that mean? Your body just rejects it, you pee it out. You're not going to get any benefit from that product. So what is the usable form? The usable form is called L-methylfolate. That's what we have in Nerve Reverse. That's what we have in our product. We also use methylcobalamin. We don't use cyanocobalamin. Cyanocobalamin, it needs to be converted. It needs to be methylated for your body to use it. We also use vitamin D3. We don't use D2. We use the best form of vitamin D as well. And we use alpha lipoic acid. We use a product called benfotiamine. Benfotiamine is a fat-soluble form of B1. And so when we look at what's in the product, it's the best you can get. You're not going to find anything better. And it's for the best price possible. So when we compare, like there's some other competitors in the podiatry space, when we compare our product to our competitors, yeah, they're going to have very similar ingredients, but most of the time they're going to be a lot higher priced than we are. So what does that do? That reduces compliance. You're not going to be able to get as many patients to buy it because it's just too expensive. It's just out of reach for some patients. So we're able to keep that cost down and still have a great quality product for patients that's going to differ from all the stuff that you're going to go buy at Walmart, Walgreens. It's when you compare it to Nervive, I mean, it's not even in the same ballpark. It's a totally different product. Going along with podiatrists, it doesn't happen very often, but we have doctors that will buy our product and they'll stock it in the office. And a year and a half later, they'll call us up and they'll say, hey, I need to return this stuff. And they'll say it didn't work. And I'll say, well, okay, hold on here. So you ordered 12 bottles of product. So really, if the patient takes it for 90 days, that's 4 patients. So I'd say, so you have 4 neuropathy patients in a year and a half that you've given this to, and you don't think it works. And then we kind of dig in a little bit deeper, and it's, well, no, actually, I only sold a couple bottles. I said, well, that's different. That means that you didn't even give it a fair shake. You didn't even try it, honestly, right? At that point, it sat in the closet. You didn't do anything with it. You forgot about it. Every neuropathy patient that came in, you just didn't explain the product to the patient, and you didn't let them know about the product. Although the product does sell itself, like if you have marketing materials out, and we do posters and stuff that can go in the clinic offices, it does really, like a lot of times the patient will just be sitting there and they'll read the literature and they're like, they'll ask the doctor about it. But if leaving it up to the patient, it's not gonna be as effective.
So what do you think then is what is like the best practices? I mean, number one, I mean, like even for me, it's like, yeah, you should have this stuff out. I mean, like every treatment room should have a couple of bottles on a shelf. It should be on the shelf in the front desk. I mean, I think that's where, I mean, if they buy it, put it in the closet, and then they're never going to think about it, because talk about four patients. I mean, you're seeing 4 patients a day that have neuropathy. You're seeing, 50 patients a week, a month that have neuropathy.
Yeah.
I mean, like this is such a common problem. So,
yeah.
I mean, this stuff should be flying off the shelves.
Best practices. So our top customers that do the best with the product and that treat and help the most patients are the doctors that we can do little display bottles that can sit out in every clinic room, and every clinic room has one of those bottles, right? And it's written on their sample, so that it doesn't get jacked and that kind of thing. But even having a display case in the waiting room, you should have literature in the waiting room on what the product is. There's a few doctors that we work with that do not give out educational information. They just choose not to. They're just like, no, we got too much stuff. And I understand that's it's your clinic, it's your office, but you're not going to do as well with the product if you're not educating the patient without you having to be there. So you need to be able to educate that patient without you having to be in the room all the time and educating that patient.
If you don't hand that to them, because maybe the patient's not going to get it right away, and I understand that, but they need to walk away with something in their hand, because again, talking about compliance. And so now, you're waiting for the patient to come back, 3 months later, and how much more damage has occurred in that time. And then the next time, like, oh yeah, that's true, let's talk about it. And so we've just lost all of this time. So just hand them the brochure. They can go out, do their own research, and they're like, wow, I can buy it here for less than what I can do online. So it makes sense.
The other thing that our top accounts do is they'll do like a video loop. So in the waiting room, if they have like a TV or something in the waiting room, we've got a real cool little just video loop that we can give them that talks about our product and educates the patient right there as they're sitting in the waiting room. And we've got, if they don't want the sound on, we've got captions on it so the patient can just read. It's all about educating. These patients don't know. They don't know. And the more that you can educate the patients, the better success you're going to have with our product. The doctors that just put it in the closet and expect to be able to move product, I don't know what to tell you at that point. You've got to be able to educate the patient without you necessarily having to be there to educate the patient. Your staff should know the product inside and out as well. And we've done a lot of Zoom calls with different staffing, with nurses, with the MAs. They need to be educated, probably even more than the doctor needs to be educated, and so that they can kind of talk about the product as well.
Well, and that's something else too, that, where some doctors are like, oh, I feel like a salesman, and I'm just a sales rep for this company that I'm out here just, selling these bills. And it's like, no, you're an educator. You are the doctor. You're the one that does your research to say this is something that is going to benefit you and you need this. I mean, this is what, nobody else has issues with that. The dentists, plastic surgeons, dermatologists, the chiropractors are like amazing at that. They walk out with bagfuls of supplements and it's not a big deal. So I don't understand why so many, or not, I'm not saying so many, but why some podiatrists feel that way. You shouldn't. You shouldn't. You're here giving your patients the best quality of care that you possibly can right there in your office.
And I can't tell you how many complaints I hear about how tough it is in the podiatry space to earn a living. I hear that over and over and over from the doctors we talk to. It's like, I'm barely making it. Well, start selling stuff. I mean,
every little thing helps.
You don't want to be a salesman, but at the same point, if you're a doctor and you're simply just educating your patients, you shouldn't feel like a salesman. You should feel like a doctor. You should feel like, I know what's best for my patient and I'm recommending this for my patient. And yeah, we just so happen to sell it here in the office, but I wouldn't recommend it if it didn't work. I wouldn't recommend it just to make money off of it. I'm recommending it because we know that this product works and it's going to help you. And that's the name of the game. And if you're looking for extra ways to bring in revenue, how simple of a product, it's not difficult.
Yeah, it's all
of
win-win.
Our products have 100% markup. So if you buy it for $50, you can sell it for $100. So it's great margins on this stuff where it's an easy thing to implement within your practice that your patients can simply just walk out and you're going to get, it's hilarious because not only is it going to help your revenue in your practice, it's going to help that the additional revenue coming in, you're going to get better patient feedback as well. You're going to get patients that say, wow, somebody finally took care of me. Somebody finally helped me. I've been dealing with this neuropathy, getting passed around from doctor to doctor. And somebody finally stepped up to the plate and helped me with this problem that I've been having. They don't even care that you sold them a product at that point. They care about getting better. And so they're still going to be spending money on drugs and that kind of stuff. So why not spend money on stuff in your office that you're going to earn revenue off of, and that's going to help the patient?
I mean, I think that's so important what you just said, Ben, because if you're in the business of podiatry, you're listening to this, you want to increase cash services, supplements are some of the lowest hanging fruit. Like you said, you're seeing all of these patients and it's not even a cost. They're not even buying it. They're investing in a better outcome for themselves at basically no risk because you'll refund them if they don't see results. It's recurring to a certain extent. So that's even better. Get them coming back, buying more, and you're generating this other revenue stream that's helping you as a practice and your patients. I mean, it's such low-hanging fruit that every podiatrist out there should be jumping to start getting some of these out in their office.
And I hear a lot of times too, we get a lot of feedback from doctors sometimes saying, well, the product's too expensive. My patients can't afford it. And my response to that a lot of times is, so you're telling me somebody that has suffered with neuropathy for years, this is just, it every day they wake up miserable. They can't hardly get out of bed because their feet hurt so bad. They can't stand for longer than 15 minutes without their feet just burning. And you're telling me that that's not, if it works, that they wouldn't pay $100 every 90 days. So a little more than $1 a day. A patient wouldn't pay that to get relief. I just don't buy that.
That's a negative mindset for the podiatrist. I mean, there's just no doubt about it. I mean, this is not that expensive. And think about the other medications that are out there that are, that blow way past that, the Bugatti of medications. This is nothing.
The patient can't afford it is a little bit of a difficult pill to swallow. No pun intended, but the patients can't afford it if it works. And how do we find out if it works? They use it for 90 days. They do that kind of trial. We get doctors all the time that ask, well, do you have any samples? Can you just do samples? Well, we could, but it wouldn't work if we did a sample. The product doesn't work in a week to them even know. So the better option is just sell them the product, sell them the initial 90 days. And if it doesn't work, we can refund their money. And for any of the doctors that are listening right now, that are worried about like, well, I don't want my patients coming back and asking for refunds all day long. We've been in business for 10 years, and I can probably count less than 10 people have come back to the doctor's office and asked for a refund. Now, does that mean it's actually worked for that many people? No. But what it means is it's the patients aren't coming back, asking for refunds, right? Every single time that maybe it doesn't work. So we do know also just some numbers to kind of put out there. We do know our reorder rates. So reorder rates is a very good indicator of how well the product is working. Nobody's going to keep taking it if they don't feel it's working. So we know that 70% of patients after that initial 90-day time period reorder after that initial 90 days, which is phenomenal. When you compare that to traditional medicine numbers, we also know that 12 months out, so 12 months after the initial purchase, 50%. So half of the patients are still taking the product. So we know that the product works and we know that it helps a lot of people. You just have to have the confidence to recommend it and show that and educate that to the patient. And if you do that, you're going to have patients coming back saying, wow, where has this product been? I haven't ever seen anything like this. This is working great for me. You're going to get phenomenal patient feedback when your patient comes back. And we have a bunch of testimonials on our website that you can read and look over, and not only from patients, but from doctors as well on, the response that they've been getting in their offices.
And that's a great segue too. Where can podiatrists find out, learn more about your products and how to get it in their office and start helping patients with it?
Yeah, so you just go to our website. It's freelifelabs.com. So FREELIFE labs, LABS.com. You go there. You can send us an email as well to our email address. It's support@freelifelabs.com. And it really, all that entails is we would just get you set up with a wholesale account, and you can actually log into our website in the back end. You can place all your wholesale orders in the back end and start selling the product right out of the office. We provide all the marketing materials for you free of charge. We do other products that we can sample as well. So we have a topical pain cream that we can provide samples for. We have a product called Derm 42. That's a 42% urea cream for people that have really dry, cracked heels. We're trying to prevent any cracks or openings, especially for diabetics, that kind of thing. We provide free samples of those products. Any of the marketing literature that you guys need, posters, all that stuff can be ordered on our website. Or you can call us, 801-923-3878, and we can get you set up over the phone as well.
A big thanks to Ben for joining us today. If you found this helpful, hit follow and subscribe and leave a quick review so more podiatrists can find the show. And if you're ready to go deeper, check out solutionsdpm.com. That's where you'll find the community and courses to help you grow smarter. Until then, we'll see you next time.